Hello, everyone. Thanks for joining me for lunch. So excited to be here. And isn't it great to be in person again and hugging people and talking to people face to face? I think we're all zoomed out, so it's really, really good. Great to see you all here. Before we start, if you want to copy my slides, because I don't think these are going to be in your app, just for a moment, you're going to have to pull out your phone. I'll send you, anyone who wants to copy the slides, I'll send them. It'll also subscribe you to my professional newsletter, which is purely content, so articles, blogs, YouTube videos, podcasts, etc. And I send it out just once a month, so it won't bother you. So if you want the content, this slides, and that professional newsletter, pull out your phone and just text one word, not case specific, healthy me, HEALTHYME, to 66866. So just text healthy me if you want the slides. 66866 is the number, and you should get a response. And again, that will never be shared. So just, I'll mention this at the end too if you miss it, but 66866, text healthy me. Okay, let's get on with it. So mold and mast cell. First of all, how many of you are seeing more cases of mast cell activation than ever before, right? I will frame this first with environmental toxic load and why we need to be thinking about the environmental toxic load. But I also want to frame it in the sense that we are seeing cases never before of an immune system gone awry, aren't we? And it's interesting because I know very well, as you heard in my bio, for those of you who don't know me, I grew up on a farm in Central Illinois, one of 5 children, lots of farm chemicals, but a very idyllic childhood, a very lovely childhood. And if you heard the lecture this morning at 8:15 on environmental toxicity, that's my story because I grew up on a farm, and at 25 years old, in the midst of medical training, my 3rd year, I was diagnosed with breast cancer. And part of my journey ever since that time has been to discover why in the world would a 25-year-old woman get breast cancer, and then Crohn's disease, and then more things that I don't have time to go into today. I collect autoimmune diseases. So all of this to say that the lecture you're going to hear today, I think, is so relevant to our medical culture because we've seen mast cell exponentially increase, but since COVID, it's even been worse. And what we're seeing is just like the chemicals for me on the farm, like atrazine and glyphosate, these environmental toxins that we're all swimming in, which I'm going to frame today for you, are part of the driver of mast cell activation syndrome. And one of the things that I like to think about with functional medicine is I frame it very simply. Most of the complex, chronic, infectious, inflammatory diseases that we see are a combination of environmental toxic load and infectious burden. It's that simple, and it's that complex. Those two things drive immune dysfunction, such as mast cell activation. Our mast cells are primordial cells that were supposed to react and protect us, but now because of a toxic world and latent activation of infections, we're seeing an epidemic of mast cell activation and massive immune dysfunction on all levels. So that should frame the relevance of my lecture today. So why study environmental toxicity? Well, I just gave you one of the reasons. Why would a 25-year-old get breast cancer? And that's been part of my life's journey, and part of that is environmental toxic load, and knowing that even though I grew up in a beautiful place where we had homegrown organic food in a half-acre garden with a retired nurse as a mother who had holistic remedies all over the place, even so, I, at 25, developed breast cancer. And so the question why and the answer to that includes our environmental toxic load. So the accumulation of toxins in our system, and we can think of this as the bucket. I love you, probably if you've heard me teach before, you've seen this slide. We can think of all of us as having a bucket capacity for detox. And when that capacity starts to fill to the top and overflow, we start to see autoimmunity, we start to see cancer, and we start to see neurodegenerative diseases. And if you caught Kat Toop's lecture yesterday, phenomenal, on some of the data around neurodegeneration and cognitive decline and what we can do about it. But if you think about those classes of diseases, cancer, autoimmunity, neurodegenerative diseases, these are some of the rising things that we are seeing in our clinical practice, and part of it, a large part of it, is our environmental toxic load. So I always say you can test the patients for environmental toxins, and I do, but as clinicians, it can be overwhelming to determine every last drop of water in your patient's bucket, right? To figure out what toxins are there. And again, I'm going to free you today to realize that all you have to do is assume that every single patient that walks into your clinic has a toxic load. And you're probably going to be correct in assuming that. And then, yes, do the test. Yes, understand there are different pathways of excretion. We'll talk about a little bit of that today. But the bottom line is the basic methods that we learn for detox, which again I'll go into today, some tools that will help you, will work for the toxic load. And as long as you give that patient some margin back in their bucket, they're going to get well. The innate ability of the body to heal is there on the level so that you can get margin back. So that's a reminder to you. So core principles of toxicity, just to remind us, environmental toxicity affects everyone. The concept of total toxic burden or the bucket capacity to detox is a great way to think about this, to talk to your patients about this, and explain what's really going on with toxic load. There's genetics that play into this. So there are genetically susceptible people like myself who were born with glutathione SNPs and all kinds of abnormal SNPs that affect my ability to unload that toxic load from the bucket. And when we have those patients in front of us, they're going to need a little extra care, a little extra support, and I'm going to talk about some of those ways you can support them today. And where this all happens, of course, is the liver, it's the kidney, it's the skin, it's the lungs, it's the lymphatics. But we're going to talk especially about the liver, the biotransformation pathways, and how to support those. So what contributes to total toxic load? Well, here's your list. And it's ever expanding: EMFs, parabens, phthalates, PCBs. Just last year, I've been talking lately and lecturing on PFAOs. And the reason for that was last summer we got a report from the Colorado water supplies where I live. They tested a lot of the public water supplies, and they found 100% of the water supplies, including drinking water and public water, was over the toxic limit of PFAS. PFAOs are basically the polyfluorinated components of Gore-Tex and Teflon and waterproofing. And you may think, well, I don't wear Gore-Tex or Teflon, or I got rid of my Teflon pans. But did you know if you get takeout food just one time, you're getting exposed to that lining that's grease-proof? Or you buy cheese or meat at the supermarket or something like that, most of those containers have PFAOs in them. So we're getting exposed everywhere in our food supply and in our water supply. Now the good news is things like carbon filtration and reverse osmosis, which you heard this morning as well in the lecture, is the best way that does decrease levels of PFAOs in our water supply. But right now I'm living in a state that has toxic levels of PFAOs, and what I didn't mention is these are forever chemicals. That means scientists cannot even calculate the half-life of the chemicals, and they're going to be around for our generation, our children's generations, and many, many generations. So it's kind of scary to realize how we are all swimming in toxic soup. And I just want to mention one more thing on this slide is the endotoxins, our internal toxins. We can get scared about all the external toxins, but right now, as we're sitting here to lunch, did you know that every one of us is having an increase in postprandial LPS, lipopolysaccharide, into the bloodstream? Because that's what our bodies do. Postprandially, the LPS will increase. And I'll show you today how that can actually increase histamine and increase mast cell activation. So you can't really read this. You'll get a copy of the slides if you texted me. But this is a list of some of the symptoms we see with toxic load. And I want to just bring your attention to the fact that many of them are skin-related. So you have patients with acne or rashes or difficult skin lesions. For example, many of you know I went through mold-related illness and biotoxin illness about 6 or 7 years ago. And one of the things that happened when I began to detox was I got a whole body hives and rashes. My eyes were red and irritated and angry. And a lot of those skin manifestations were just a sign that my biotransformation was completely overloaded. And when your liver pathway is overloaded with toxicity or you're detoxing too quickly, it will often manifest in the skin. Did you know as well that C4A, which is a split complement product we check in lab work often for mold exposure, is associated with cystic acne? So you have a young person or a middle-aged person who has cystic acne and you cannot find a cause, check C4A, check for mold, because sometimes mold is the cause of acne. Spectrum of vulnerability. This is just a reminder that there is a spectrum of vulnerability, and we tend to see the people on the left side of this curve. So the classical toxicologist will tell us, okay, there's this average threshold of harm, and so if we pull that level down to a certain limit, we're gonna catch like 90% of the people and say this is the toxic limit. But what they're not talking about in classical toxicology is the hormetic effect of these synergistic chemicals. So often when combined, they have a synergistic hormetic effect, which means they have a biphasic curve. So there's a very, very low level of activation of toxicity because it has a hormone-like effect on the body, and a very, very high level. But we're not talking about the fact that these synergistically low levels of chemicals have a profound impact on our human body. Case in point, the work of Tyrone Hayes around atrazine. When I found out about my breast cancer and started looking at causes, I looked at the map in central Illinois about the use of atrazine. And I literally called my dad, who's a farmer, and said, Dad, are they still using atrazine in Illinois and in the US? He said, yeah, Jill, sadly they are. It was banned 20 years ago in the European Union and is no longer being used because they know about the toxic endocrine disrupting effects. But Tyrone Hayes studied frogs in this environment with atrazine, and they had no genitalia or ambiguous genitalia. So it absolutely has a hormetic effect at low levels. So let's switch to mold, because that's the topic of our conversation today. So that's an overview of why environmental toxicity matters and why it may be the most important thing in your clinical practice to address if you want patients to heal. So mold. 2013, we had a flood of epidemic proportions in Boulder, Colorado, where my clinic is. They estimated $1 billion of damage and thousands of homes and businesses affected. 1 year later, I started having shortness of breath walking up the stairs of my clinic. And I was in pretty good shape. I had just run a 10K race. I started getting rashes around my eyes. I started getting chronic infections. And it wasn't too long later that I tested the basement of the office and found Stachybotrys. And I tested my urine and I found trichocythanes, which are the types of mycotoxins that particular mold produces. The day I got the results of my urine test, I left everything in my office and I never set foot back into that office. And it saved my life, and I don't feel like everybody who has mold-related illness needs to be that drastic, but one of the things I left was my bookcase of hundreds and hundreds of books from medical school, and I love books. And it was sad, but the more important thing was the fact that this flood had caused water damage, which caused mold, which was massively taking me down and affecting my health. So I had to figure this out, and I had to figure this out to survive and to teach you and to teach my patients. These are some of the symptoms, and as I've been talking, you've probably been reading through. The number one symptom of mold toxicity is brain fog, subjective cognitive decline, word finding, or cognition-related complaints. Number two is fatigue. So think of how many of your patients have brain fog and fatigue. Like, raise your hands. Is that like every other person that we see, if not everyone? So mold is a big thing in the background, and most patients don't know. If you ask a patient and say, are you affected by mold, or were you exposed to mold? Most of them will say, no, I have no mold. Or they might say, we had an inspector come and we had a good report. Most of the time when there's mold, you have to have a high index of suspicion. And instead of asking them, do they have mold, you want to say, have you ever had any water damage from your dishwasher? What about your washing machine? What about your fridge line? Last summer, the apartment, I'm in a condo of 4 stories, and the condo above me, his fridge leaked unbeknownst to me, flooded my condo behind the wall, under the floor, did not know this, and I started having brain fog and overwhelm last summer. We tested and found cotomium growing in my condo. So you really can't be too safe. The takeaway from this is worth your price of admission. Do not hook up your water line to your fridge if you're worried about mold. There's too many cases of that water line leaking or not being attached correctly. From now on, in every house that I own, that automatic ice maker is not worth the price, and I will never, ever hook up a fridge again. So think about that when you go home. You might want to unhook that water line and make your own ice cubes with filtered water. So just a thought. Okay, so mold. So why is it important? It's important to find the source when you have mold because avoidance is key. Now, I'm not one of those people who believes that patients should go out camping for 6 months, outside the home and be so drastic as to they can't live indoors anymore. Yes, there's a few patients like that. Mold avoidance is key, but I still believe there's often ways to remediate and clean and do the right thing there. I do not believe everybody has to walk away from their home. And I think that's important because patients get completely overwhelmed. Did you know that mold and chemicals have an amygdala response, this is in the research, that triggers a limbic response of PTSD, even if you know you're safe and even if you know that you can get out of the mold? So there is a very, very significant chemical trigger just from inhalation of chemicals through the cribriform plate that triggers the hypothalamic pituitary axis to activate the amygdala. So all patients who have had mold exposure as part of their illness need to do limbic work, and we'll talk about that today too. So I often ask, when did things start? When did things get worse? You have to do a really good timeline, as we learn in functional medicine, because a timeline will tell you when it started, and a timeline will help you determine if there was an environmental impact like a home or a workplace that caused their illness. This is an older paper now, it's 10 years. I've been teaching for a long time on this, but I like this paper because it talks about, in medical school we're taught that mold is an allergen, which is true. That would be the adaptive immune system. But we aren't taught about the innate immune system response. And this is a much bigger deal when we have cytokines going haywire. Many of you as physicians or practitioners know about the innate immune system, but the general public during COVID learned everything about the innate immune system when we started talking on the news about cytokines. And they're like, what's a cytokine, right? That's innate immune system response, and mold, like COVID, has a dramatic innate immune system response as well. And when we understand that, we can understand the myriads of symptoms from brain to gut to heart to POTS to dysautonomia to adrenal dysfunction to endocrine dysfunction to estrogen dominance to low testosterone and all of the things in between that can be caused by mold. So this talks about all the different mechanisms: oxidative stress, toxic exposure, cytokine production, innate immune system, etc. And why are mycotoxins such a big deal? I recently heard a colleague who's in the mold remediation business talk about an analogy, and I told him I was going to steal it because I love this. So what he said is, behind that wall, say there's mold growing behind this temporary wall, and we don't see it, we don't know it's there, it looks good in here, but we're having headaches and brain fog. That's the factory, that's the production spot in your home of the mold. And that factory needs to be dismantled in order for you to get well. But what many physicians, remediators, and people in this industry do not understand is that factory's been producing smoke for months, if not years, into your home and your place. That is the mycotoxins. Mycotoxins are ionophoric. They are less than 2.5 microns in size. They directly go into our alveoli, into our bloodstream within seconds of inhalation. And once in the bloodstream, they start to deposit in the tissues. And they deposit on our books, on our paper, on our porous materials. So you could do a great job getting rid of the factory or the mold behind that wall. And in your home, you still have loads of mycotoxins, and in your body, you have accumulated mycotoxins. This is the pearl of why some of our patients with mold-related exposure are not getting well. Either you haven't cleaned up the environment from mycotoxins after you dismantled the factory, you didn't get rid of the smoke, or in their body, they have mycotoxins just like any toxin, like PCBs and parabens and phthalates and PFAOs and all these things we're talking about. They accumulate in the fatty tissues and get stored. So part of your detox must be getting rid of the smoke, and that involves a fogging with a dense fog that's oil-based that brings down the particulate, and a small particulate clean. And usually those patients who get that done after remediation, they're going to get well. Toxins can also attach themselves to insulin receptors, to leptin receptors, to hormone receptors. So part of the illness that we see with mold affects the endocrine system, the hormones, the adrenals, the brain. So all of these things can be affected by those mycotoxins in the body. And this vicious cycle of mycotoxins in the body in someone who genetically susceptibly has difficulty removing them causes this vicious cascade of innate immune system activation and cytokine production. So it's actually your own body often creating and sustaining that damaging process. The whole body suffers from misdirected friendly fire. Biotoxins that cause sears, mold is one of them. The common Stachybotrys, Chaetomium, Willaria, penicillin, Aspergillus, and many, many more, Fusarium. But other biotoxins can also cause innate immune system dysfunction, like Borrelia, Bartonella, Babesia, Cingulata, and some of the freshwater tides that are red tides from marine dinoflagellates. These can also cause issues in patients. And I want to mention that we talk about mold, we focus on mold, but in a water-damaged building, there's more than just mold. There's a toxic soup of actinomyces, beta-glucans, VOCs, sometimes candida, and other things, and all of these things work together to create innate immune inflammation. It's not just the mold. And this is from the literature. I could pull 20 or 30 studies to support this. I have the references, but mycotoxins, the smoke from the factory, are carcinogenic, hepatotoxic, dermatoxic, immunotoxic. Did you know that one of the ones we commonly measure called mycophenolic acid, it can be measured in a urine mycotoxin test. That mycotoxin is used to make the drug Cellcept. That's an organ transplant drug to suppress the immune system. So these are massively immunosuppressive. And back to my original premise when we started the lecture about toxic load and infectious burden. These go hand in hand because when you have toxic load weakening the immune system, infections pop up. So many times we see a patient and they have positive Borrelia titers, they have Lyme disease, they have had a mold exposure, they have heavy metals, they have loads of toxins. Where do you start, right? Always start with the toxic load and mast cell, and I'll tell you the order of operations in a few minutes. Because if you decrease that toxic load and you unweight the immune system, often they don't need a bunch of treatment for the infections because their immune system functions like it should. Now, sometimes you still need to treat those, but there are cases where they never need treatment for Lyme disease. They get well once you get them out of the toxic environment. And I just want to remind you, questions are key in the history taking. Just asking them with their timeline, when did you last feel well, is very, very helpful, because then you can figure out if there was an environmental change. They moved to a new city. They moved to a new home. I found after the 2013 floods in Boulder, Colorado, many, many houses were damaged. So I heard stories that ever since the flood, I haven't felt well. And this is just a reminder about infection and toxic load. Those two things go hand in hand. Because if you have a toxic load suppressing immune system, you can have old things like Epstein-Barr reactivation, or shingles pop up, or Lyme disease symptoms, or Bartonella, or Babesia, or Ehrlichia, or any of these number of infections. Okay, so that's a little primer on mold. Now we're going to shift to mast cell activation. What is it? How do you treat it? How do you diagnose it? And then in the end, I will give you a how-to guide on how to treat biotoxin and toxic-related illness. Sound good? Okay, mast cell activation. So what is mast cell activation? First of all, triggers, like I said, mold is at the top. So suspect if there is mast cell types of symptoms that mold is one of the culprits, and you want to be looking for mold. Best way to test for this is you can do blood work, VEGF, TGF-beta, MSH, antidiuretic hormone and osmolality, and MMP9. Those are the 5 that I test. That's in the blood. Now, those are not diagnostic for mold, but they direct you to innate immune system dysfunction, and then you have to say why. In the urine, you can test for mycotoxins. There's 3 labs that do that. You can test any of those labs, give your patient a mycotoxin test, and determine if there's mycotoxins in the urine. And when you look at the big picture, the history is positive. You can do a visual contrast test online or in your office. You can ask about symptoms, and then you can do blood work and urine, and that big picture will give you an idea if there's likely mold or not as a culprit. Triggers are chronic inflammation, immune dysfunction, mitochondrial dysfunction, oxidative stress, and glutathione depletion. And these things work together to create more mast cell activation. So it's no wonder as you look at that list that we understand why we're seeing such a bigger epidemic of mast cell activation than ever before. So how do we address this? This is a slide from one of my blog articles, and this talks about the actual pharmaceutical options. Now, I do not use all of these, but I'll tell you a few of my favorites. But if you're in a crisis, steroids will help. If you're in a crisis, immune modulating drugs will help. There's some of those, they all end in the MABs, and they're all immune modulating drugs for specific like TNF alpha blockers, et cetera. And each of these can be helpful in situations, but they're rarely used in the beginning. What we typically use is H1 and H2 blockers in combination. So for example, Zyrtec and Zantac or whatever. And what we often add to that is mast cell inhibitors or mast cell stabilizers. Those could include montelukast or ketotifen, which must be compounded. And that slew right there is my favorite place to start. But in a few minutes, I'm going to give you some natural options that surprisingly work very well. So almost everybody I have with mast cell activation is on some form of quercetin and lutein in the formulas that I'll show you. Okay. These are diseases, just a reminder that sometimes mast cell can masquerade as endometriosis or interstitial cystitis or eosinophilic esophagitis. And you want to know that because if you see these things and they're not getting better, you may want to think about mast cell activation as an underlying root cause. This is a paper I definitely, again, you can get a copy of my slides. I'll repeat at the end of how you can get that copy. But this paper is worth reading. It's by two of my close friends, Dr. Theo Theorides and Dr. Tanya Dempsey and more. There's probably maybe some of you have contributed in the audience. It's a great consensus statement on how to diagnose and treat mast cell activation syndrome. And it's the best paper that I know of right now that's published that gives you the guidelines. This is from that paper, just showing the signs and symptoms all over the body: anaphylaxis, rashes, chest pain, tachycardia, diarrhea, etc. Did you know heartburn is often a mast cell symptom? And many people I know that have mold-related illness, one of the things they might get when they walk into a moldy building is heartburn. This describes some of the skin criteria for actually the criteria in general. Again, this is all in that article, the consensus, global consensus statement. I'm going to go back just to show you really quick. Diagnosis of mast cell activation syndrome, a global consensus 2. Take a look at that paper because it's all there, and it's worth your read. It's worth having in your clinic right by your desk so that you can reference it. But a diagnostic criteria involves episodic symptoms consistent with mast cells, so symptoms are key, a decrease in frequency or severity of symptoms when you treat it, and evidence of validation by urinary N-methylhistamine, prostaglandin D2, or its metabolite. Now, I'll use tryptase and serum histamine as well, and these are all described in the article of how you can diagnose this. But this is a clinical diagnosis ultimately, which means clinical symptoms consistent with mast cell that respond to treatment. So you may not find the serological or urinary metabolites that you're looking for. This frequently waxes and wanes, and because of its nature, if you're not catching them in the lab or with a urine sample, and the way this metabolite works in the urine, both histamine and the N-methylhistidine, it's very, very susceptible to heat. So if they don't grab their urine and put it immediately on ice and take it on ice to the lab, it will not be valid. So it's kind of hard to use this criteria unless you know that that patient's going to do that test correctly. Okay, so I mentioned before some of the things that I love to use. This is one of my favorite products for mast cell activation, and it's the only one I know on the market that really combines all of the things that can control mast cell stabilization and antihistamine. It has quercetin, perilla fruit seed extract, luteolin, fistian, and black cumin and stinging nettles, and they're all present. So basically you have the mast cell stabilizer and the histamine blocker, all in one. And again, there's a lot of products on the market that have histamine blockers like quercetin or have mast cell stabilizers, but I really like this because you've kind of got an all-in-one product. And you can see the mechanism of action there. And again, twofold, you've got that mast cell activation and histamine intolerance. Now, histamine intolerance, very interesting because back when I had cancer and then Crohn's disease at 26, I definitely had histamine intolerance, and I did not know. I started avoiding certain foods, like dried meats or jerkies. I didn't eat them much anyway. Fermented foods, and all of these later I found out were high histamine. So unbeknownst to me, I was on a low histamine diet and I didn't even know it. So I absolutely, throughout my life, allergies as a child and then eczema as a child. My brother had severe asthma. I've had histamine issues all my life. And these kind of things have been so powerful in supporting me. And we're going to talk about a probiotic that's super helpful in a moment, and I'll tell you the story about how that relates to me 20 years ago as well. So what we want to do is have enough DAO, dioxamine is the thing that will help to break down histamine in your meal, like as you're eating right now. And if you have histamine intolerance, that could be a game changer as well. And we talked about this, but the bottom line is Histoquell really combines all of these processes, so you have one product that deals with histamine intolerance and mast cell activation all in one. And it works. I use this in clinical practice. This is the probiotic I mentioned, and the studies here are great. And I have a personal story. So back when I had Crohn's disease, I tried lactobacillus and this was 2001, so it's been a while. And back then, I tried different probiotics, and none of them went well with me. I didn't do well on probiotics. How many of you have patients that just don't tolerate probiotics in general, right? Yeah, see, almost half of you are raising your hands. I was that person. I stumbled upon a company that back then was like the only one that had it, Bacillus coagulans. It was a spore. And all I knew was it was the only one that helped my Crohn's disease. I knew none of the data, none of the research. I was a mere third-year medical student trying to get over Crohn's disease. But I knew there was something special about this probiotic. This is one of those reasons you'll hear me talk a lot about spores, because I realized in hindsight how powerful that probiotic was in my own healing. And the studies show that this probiotic will actually help stabilize and degrade histamine. And in this particular probiotic, we have Bacillus subtilis, Lactobacillus rhamnosus, Bifidobacter lactis, Bacillus coagulans, the one I mentioned, and Lactobacillus salviarius. Histamine-degrading strains, the ones that actually break down histamine, include Lactobacillus rhamnosus GG and Bifidobacter lactis. Now, in hindsight, I had histamine intolerance, didn't know it. Bacillus coagulans worked. I didn't know why. This was back when I was 26 years old. But the third thing is, I noticed that Lactobacillus casei and some of the regular strains of Lactobacillus made me feel worse. Some of those strains will increase histamine. So if you have someone with mast cell activation and histamine intolerance, you must use the right probiotic or no probiotic at all. It's very important, and you're going to see this in your patients. And you're like, well, this is supposed to be a 100 billion, 10-strain probiotic. I don't care. Because if it contains some of the strains that create histamine issues, they're going to have a problem with that probiotic, and that's why this is a game changer. This is very well tolerated in your mast cell patients. So let's talk briefly about other treatments, and then I'll show you the data on that. So low histamine diet can be helpful. That would be mostly fermented foods and things that are aged. If you get, basically histamine comes from proteins that are broken down, which helps you realize what kinds of food might contain it. So any smoked or preserved meat or cheese, any aged meat or cheese, anything that's like a salmon that's caught and sits in a freezer or display at Whole Foods for 5 days, that's going to be high histamine. Leftovers are going to be high histamine. So these are ways that you can remember some of the high histamine foods. And some of the really wonderful, beautiful foods for our gut, like fermented foods, kimchi, sauerkraut, they're very high histamine. So some people will not tolerate them. And bone broth is in that class as well. DAO enzyme support, we talked about how Histoquell can support the DAO, and you can actually give DAO enzymes as well. That would be like your DPP4 and related enzymes. We talked about identifying sources of mold or other toxins and decreasing toxic load, because that's one of the drivers of the mast cell activation. Sweating is so powerful as a way to detox, so whether they can exercise or use an infrared sauna, and you heard the data, I think, Wednesday or Thursday or Friday on that, on sauna and the power. Part of the power is it allows us to mobilize toxins from the tissues and get them out of the body. Promote gut health, get enough sleep, reduce stress, and low-dose naltrexone can also be helpful in a subset of patients. Because by nature, what it does is endogenously increase your endorphin production, and that in turn downregulates cytokines. So high histamine foods, I went through some of these, but this is a list: fermented dairy products, fermented vegetables, fermented soy, certain fruits like citrus, some vegetables, avocados, eggplants are at the top of the list there, all shellfish. Here's some more: preserved oils, and again, you can read this. And you can look up on my blog or online on other sites and find a low histamine diet, and that can be really, really helpful in the beginning if you have patients with histamine intolerance. And like I said, you want to think about those conditions that are commonly associated with histamine intolerance, like interstitial cystitis, endometriosis. Did you know infertility? How about that one? That has associations with histamine intolerance and mast cell activation. Okay, So now we'll shift to what do we do about mold and biotoxin-related illness. I'm going to run through the different steps and make it hopefully very, very simple in what to do and how to treat. And then we will end with pulling this all together. So I like my little guy. I think that in flight, because fight or flight, that's a reminder that the limbic system relates to fight or flight, so the rabbit is getting ready to fly. Limbic activation. You might be like, Jill, why in the world are you talking about this? Well, I just told you earlier, my research for my book, I realized that, yes, mold is a scary thing, and going through the fact that your home is no longer safe is a big deal. But beyond our emotional and psychological reactions to mold and mold-related illness, there is a limbic chemical response just from the inhalation into our brain's HPA axis triggering limbic amygdala. It's there, and we all have that. That's part of the literature. And because of that, every one of your patients who had mold-related illness, mast cell activation, or anything in that category, you need to at least think about limbic retraining. Now, I am not the expert. How many people out there are experts in somatic behavioral therapy, brain retraining, neurolinguistic programming, any of these types of things that may affect the brain? Do we have any experts out there? See a few hands, maybe. Most of us are doctors or physicians or nutritionists or chiropractors or naturopaths or whoever else I didn't mention, and we may not have the training, but this is my simple list, and there's so many more out there, and you don't have to be expert. You just have to find someone or some people in your community or resources that you can just mention to the patient how important this is. I started with some books that I love. The second 2 or 3 things are things like Brain Tap with Patrick Porter, Dynamic Neural Retraining System, Gupta Program. I just heard about another one called, I'll think of it in a moment, Primal Trust, I think it's called. So there's many, many of these programs out there. You guys probably know more than even I know, but you want to get your patient just at least thinking along the lines of limbic retraining, because this gets to be a limbic loop. And this is why some of those people feel like they can never go back inside and they're camping out in Utah, because their limbic system became activated and now they're terrified of being indoors with mold. And we have all had those kind of patients. And it's real. It's so real for them. Heart math, binaural beats. This is something you can go on Spotify or iTunes and just search binaural beats and find music that has different hertzes in each ear, and it calms the limbic system. You can use PEMF at the right frequency. There's so many ways to do this. Cranial sacral therapy. And I kind of like to think about it as either passive or active. You know those type A, executives that come into your practice, and probably most of you in this room are like that type A person too. And they are like, you give them one more to do and their head explodes because they're so overwhelmed with their business and their schedule. Those people you don't want to put in DNRS. Those people you tell them to go to the cranial sacral therapist and relax for an hour with a massage or treatment. So there's 2 types of things here, and I take into account what kind of patient I'm treating, because many of those are already a little bit OCD or so obsessed with doing it right that adding 1 more hour or 2 hour a day of training, like I said, will just blow their head off. So think about that. Breath work. Breath is so powerful. That should be at the top of my list. Medical hypnosis and neurolinguistic programming. And this is just a short list. But hopefully it gets you thinking about who you can refer to for this limbic system, because this is core. How many of you have had the patients in your practice that you know are reactive, maybe have mast cell activation, and you try to give them one supplement or one simple thing and they react, and you're stuck, right? Yeah, this is where you start. I've had patients that say they react to water, and it's real, right? I mean, they really have a reaction, whether it's psychosomatic or physiological. So this is so critical, and why I start here, because if you pull down that limbic system activation, and this has to do with, I could do a whole lecture on trauma and the hot topic right now, but this is so critical. Okay, so now we're gonna go into what to do. These little green guys are gonna remind you of the steps, and I think they kind of look like molds, so it'll just stick in your mind. Remove exposure. This sounds so simple, and yes, it's so hard. You must get them in a safe environment so that that factory and the smoke it's producing are not affecting them. Because no amount of supplements, IVs, hyperbaric oxygen, ozone, you name it, will fix the problem if they're swimming in toxic soup. They need to have that water level removed just enough to get well. They do not have to be a perfectly pristine environment. So this does not have to be perfect. And you're gonna help them determine. You want to find in your area, if you don't already know, indoor environmental professionals. One way you can find them is on ICI's website. That's International Society for Environmentally Acquired Illness, they train and just do mold only. So they have practitioners that are just indoor air, they're not doctors, they're not physicians, they're air quality specialists. And that's a way, if you don't know in your area, to find someone, that's a great resource. And then like I told you, the whole problem, people are like, well, I remediated and I'm still sick. What would you do? Any ideas? Shout it out. If they say, I remediated, and you see signs they still have mold, and they come into your office wanting help. Any ideas? Just shout something out, and I'll tell you the answer. Detox, someone said, yes. What I would do is have them do an ERMI. So let me talk about this real quick. ERMI is a test. It's a qPCR. And let me tell you the language around this so that if you talk to a professional inspector, they don't think you're crazy. ERMI was a HUD housing system they did to determine toxicity of homes. They took 600 homes, divided them into moldy, not moldy, tested them, did a logarithmic scale of the types of mold they found, and gave us a scale. Later, surprise, surprise, they found the non-moldy homes also had mold, many of them. So that scale does not work, it's not valid. I don't use the ERMI score. However, the technology of ERMI is qPCR. It's PCR testing of mold in the dust of a home or workplace. That's valid. So I still order and have patients order ERMIs all the time. I just ignore the ERMI score and I look at the actual mycotoxins because those levels are valid. But if you're talking to a professional, you want to use the term qPCR and not ERMI, or they'll think you're crazy. They'll think you don't know what you're talking about. But what I would do in someone who didn't know, they said, oh, we remediated, everything's great, I'm still having symptoms, they have mycotoxins in their urine, I would say, go order an ERMI test, test your home, bring me the results. And then I would look for things like chitomium and Stachybotrys. And I would look for the toxic molds and what their levels are. And if I see some concern, then I would have them call an inspector and get another inspection and see if there's something else going on. Because I've seen over and over and over and over again, hundreds of times, someone remediates, thinks they're fine, and they're not well. And how many of you have seen that too, right? I think that's the biggest conundrum as a physician, because we are not environmental experts, right? So we have this thing that we have no control over, their environment, and we're trying to get them well over here, but we're stuck if we can't get them in a decently clean environment. So this is a big conundrum. And I'm going to give you a little bit more boldness, because if you don't get them into a decently clean environment, and I am not saying to tell them to leave their home, but I'm telling to make sure you test again, even if they told you. I have had patients that have 1, 2, 3, 4, 5 inspections, and on the 6th inspection, they find a massive issue of mold in their master bathroom. So do not believe them. I mean, believe them because they're just taking the advice of their trusted advisors. But if you suspect clinically that there's an issue, keep looking and help them to keep looking to make sure you're not missing it. So that's important. Step 2, moldy guy number 2, detox. Okay, how do we detox? So basic principles. You've probably heard me talk about this before. I like to make things simple because some of this stuff is overwhelming and frankly depressing. But we can go back to simple things. Clean air, clean water, clean food. I love saying this, I love talking about it because we all have access to this. No matter if you are very low income, very high, wherever you are in the spectrum of patients that you're seeing, or even us in this room. And it starts with us. We should all be practicing this. Clean air. You should have a good filtration system in your home, whether it's you want a HEPA filter, that's going to be particulate, and you also want a VOC filter in that HEPA filtration system. And most good filter companies, Austin Air, IQ Air, Air Doctor, those are 3 of my favorites. They all have HEPA filtration and VOC in the same thing. So in your bedroom, in our toxic world, 80% of our toxic load is from the air that we breathe. We should all have an air filter in our bedroom. Nowadays, I believe that. Clean water. I just told you my state of Colorado PFAOs are every water supply tested at a toxic level, and they're forever chemicals. That's scary. We should all be drinking filtered water at home and wherever possible. Try to avoid plastic water bottles. When you're traveling, it can be hard, but get a stainless steel bottle or a glass bottle to take with you and refill it. And make sure your water source is clean. Reverse osmosis is the best, but you're going to decrease the mineral content, so then you have an acidic product. So you want to replace minerals, or even some of the countertop and fridge filters, like not in your fridge, because I just told you to disconnect your water lines, but the actual pitchers in the fridge clearly filters what I use, and there's others out there. Clean food. I just talked to someone, I can't remember who it was, out there in the hall this morning. We were talking about how we take food. We are obsessive. I'm obsessive about my food. Because I always say, it's okay to be high maintenance if you're high performance. That's my favorite line when I come in for the weekend with 2 suitcases and an air filter and a PEMF mat, right? But you know what? I love to perform at a high level, and I know what it feels like to feel amazing, to wake up without an alarm. And I'm willing to do whatever it takes to do that. So back to food, I bring my own food. I pack a salad for the airport on the plane. I don't eat the airplane food. I don't eat the airport food. And I do those things. If I see strawberries commercially available, they're beautiful, they're red, but they're going to be loaded with pesticide because they're always in the top 12 of the Dirty Dozen every year. So these things, as we start to implement them, and if we in this room, we may think this lecture is about your patients. But let me tell you, it's about us. Because if we are not modeling and practicing the things we're trying to teach our patients, we're not good for the advice that we're giving. And then check in your home off-gassing sources. Laminate countertops, wood flooring can be full of formaldehyde, cabinets, all these things can be off-gassing and sources. So basic principles, I like to just think about simply optimize, diversify, support, and enhance. Optimize elimination, excretion, hydration, sweating, bowel function. Diversify, gut microbiome is huge, and the multibiome from Research Nutritionals is a great place to start. Support mitochondrial function. We're not talking about this today, but I gave a lecture a few weeks ago on mitochondrial function, and one of my favorite things is ATP fuel. ATP fuel is a Research Nutritional product that contains everything your mitochondria needs to heal. Love it. And enhance biotransformation in liver. So if you remember this back in medical school, we're using it again. And the bottom line here is we need to work on phase 1 and phase 2. Phase 1 takes a fat-soluble metabolite from your tissues, puts it into an intermediate, and then takes that intermediate in phase 2 and puts it into a water-soluble that will be excreted into the bile. And this is why bile flow, gut function are so critical. But all of these things require glutathione, sulforaphanes, glucuronidation, which is like calcium D-glucarate, and all of the support we need for the liver is crucial for this process. So glutathione, like I said, master antioxidant, absolutely crucial, and this liposomal form, Trifortify, is one of my favorites for multiple reasons. Number one, highly absorbable, well-studied for absorption, well-studied for efficacy. I'll show you in a moment a slide on the efficacy. But more than that, it tastes really good. And glutathione, if any of you know, sulfur-based, it tastes like rotten eggs if it's not done right. The kids love this. There's watermelon and orange. The flavors, definitely stop by their booth because they have samples. You can taste it for yourself. This is a study that was peer-reviewed and clinically published on increase in blood glutathione, decrease in lipid peroxide, which is an oxidative stress marker, and increase in natural killer cell function, which is what fights infections and cancer. And these were all over a 2-week period. And you can see 28% increase in glutathione, 25% reduction in oxidative stress marker, and 400% increase in natural killer cell function. I talked about this. I won't read this slide for you, but there is so many benefits of liposomal glutathione. And while you can go get an IV every week or two, number one, it's expensive. Number two, it gives you up and down levels. And this gives you steady state access daily. Even places like Florida, where we're all here, I won't tell you which rooms exactly, but I'm a mold dog, so I can tell you around here there's a few rooms that are moldy. And if you guys have noticed, go get your glutathione at Research Nutritionals later. Come by, get a copy of my book, and get your glutathione. How about that? Okay, and this is one of my new favorites. Their Mycopol is a mycotoxin binder. It's got humic fulvic acids, which are phenomenal for supporting the gut microbiome and as a binder. It has activated charcoal, which is my absolute favorite basic binder for mold, and it has zeolite and silica. So this is a really great combination product to use, and sometimes I'll use this alone or with the toxin pole. I'll often use 1 cap of this and 2 caps of toxin pole from Research Nutritionals once or twice a day on an empty stomach. It works really well. And you think about toxic load and loading that bucket down, these two together are just phenomenal. The interesting thing about, 6 months ago, my brother, I still have brothers and siblings on the farm in Illinois. And while they are all non-GMO, 100% of their farm is non-GMO and partially organic, they still do use chemicals on part of the farm. And my brother called me and said, Jill, I just got dumped on with this, herbicide or pesticide, like it spilled all over him. And I'm like, oh. my poor family, right? And it was the day the research nutritionalist rep was at the office. I'm like, what do we do? Do you have anything good for this? She pulled out the toxin pole. That day, we shipped to my brother Jeff the toxin pole, and he took it, and it was helpful. But it was really interesting to have that kind of a product that really covers all bases. Okay, mold guy number 3, support the gut in phase 3. Liver converts fat soluble. So we talked about liver biotoxin transformation, and the reason the gut is so important is because the microbiome helps us biotransform things that are toxic, and also the bioflow to the gut and the elimination are so crucial to getting these toxins out of our body. So if I had to summarize so far, you'd say get out of the exposure, enhance your glutathione, and you can take liposomal glutathione. Once in a while, patients won't tolerate that. What do you do then? So if they have massive oxidative stress and reactive oxygen, they may oxidize the glutathione and not reduce it. And in that case, you can use precursors like N-acetylcysteine, lipoic acid, selenium, vitamin C, glycine, and glutamine. And those are all precursors of glutathione. But then back to the gut. So we said, get out of exposure, enhance glutathione, enhance biotransformation, which is liver, gallbladder, support the liver, gallbladder, and bile acid production. Milk thistle is a powerhouse. Sulforaphanes, powerhouse. And you want to make sure they're not constipated. So keep their bowels moving. You can use something like just magnesium citrate is my favorite. Buffered vitamin C powder is wonderful. And if you need senna or any of the other herbs like aloe, those also work. Okay, I want to talk briefly about histamine in the gut, because what you might not realize, so thinking back, I had Crohn's at 26. I had histamine intolerance as part of that. And if you think about the story, I had breast cancer, 3-drug chemotherapy. One of the drugs I had was Cytoxan, cyclophosphamide. Cyclophosphamide is known to work by inducing leaky gut. And then I had this gene called NOD2, which makes me high risk for Crohn's. So is it any wonder, if we think about the story, that I had breast cancer, drugs to cure the breast cancer, which induced massive permeability of my gut, the dumping of the contents like lipopolysaccharides into my bloodstream, this gene, which was probably not active at that time, became more activated because Crohn's is really just an abnormal immune response to a normal microbiome, and I was dumping microbiome contents because of leaky gut. 6 months after my chemo, I developed Crohn's. It makes sense, doesn't it? Like, it actually makes sense. And all that to say, part of this LPS and histamine in the gut is because the damage of the villi. So when you have leaky gut, so when you have a parasite like Giardia, when you have celiac disease and people are eating gluten and they don't know they have celiac, when you have alcoholism and there's massive alcohol, when you have Crohn's or colitis, and I could name a bunch of others, where you have damage to the microvilli, that damage is actually going to increase histamine. And I just told you, I didn't even know what it was, but I had histamine intolerance. So it makes sense on kind of the order of operations, the cancer, the chemo drugs causing the Crohn's, causing leaky gut, causing damage to the microvilli. And I didn't even mention I had silent celiac disease. So all of that was the perfect storm for me to have histamine intolerance. And DAO is made by these microvilli, but when they're damaged in celiac, in Giardia, in Crohn's disease, in colitis, you're going to get an increased histamine issue or decreased ability to break down histamine because your microvilli are not producing the DAO enzyme. And you can use the histoquel, and you can use DAO enzymes as well. And then LPS has a histamine connection. I'll just read you the main point here. LPS increases histamine production by 4 to 15-fold, depending on the tissue. So just that LPS that we're all getting postprandial right now, all of us, it's part of the fact of life. Little interesting pearl. How many of you have those patients that say, doc, if I could just not eat, I'd feel well, right? They have LPS endotoxemia, which is a whole nother lecture, but it's all to say they have leaky gut. That's a piece of the puzzle. Okay. So detox phase 3, the gut and the liver, elimination diet can be helpful, getting them off foods like corn and soy and wheat and gluten and dairy and sugar and alcohol. That's helpful. 5-hour program to heal the gut, that's a whole nother lecture. Restore and get rid of dysbiosis and put back in the good things, all that good stuff that we do for the gut. The typical things I will use now are spore probiotics and immunoglobulins, like bovine immunoglobulins. Those are 1-2 punch, sometimes adding butyrate. Those are super powerful healers of the gut. Stool bulking agents and fibers can also act like binders for mold, so it's wonderful to add in chia, flax, psyllium, any sort of fibers. Castor oil packs, coffee enemas. Us medical doctors don't talk a lot about them, but there's good evidence, and they are very supportive of this detox process. Cholagogue herbs would be those things like bitters and things that cause the bile acid to be secreted, ginseng, artemisinin, etc. When we went to the Swiss Mountain Clinic for 2 weeks for a liver detox, every meal we had a little jar of the artemisinin, and it was powerful. It's very, very bitter. I now use it in my purse at dinners to say, hey, would you like some bitters? And I give it to my friends and watch their faces. It's so fun. So back to the multibiome. I'm going to go through this because I have just a couple minutes and I may have time for questions. This is just all the benefits. And I'll tell you how you can get a copy and read these. I don't need to read them to you. We talked about the benefits of Bacillus coagulans and Lactobacillus rhamnosus. There's tons of published research on these strains. The bottom line is there's great research to support my claims. Okay, address sinus involvement. This is something that's very controversial. If you're there's a colleague of mine who teaches about mold who doesn't believe in this, and I won't mention any names, but I highly believe in this. And the patients who have been to see me that haven't gotten well with other practitioners, often they have colonization. So treating with herbs, antibiotics, or antimicrobials like Sporanox can be powerful. And then fungal colonization, again, this is possible because of weakened immune system. So you can look at things like stool culture. You can look at arabinose in the urine, organic acids. You can look at Candida, IgA, IgM, and IgM, IgG in the blood to see if they might have Candida and treat it if it's there. This is one of my favorite Candida supports as well. It's a comprehensive herbal blend. It's very strong, so go slowly, but it has a nice anti-Candida blend that works well with your other protocols. Okay, last slide, and then I have just a couple minutes for questions, and I can let you guys go. This is just the whole big picture thing. We talked about limbic activation. Now we're ending with stress detox because stress is part of this. Stress can be part of mast cell activation. And these are just some tips. Limit social media news consumption. Stay present. Set boundaries. Move your body. It doesn't have to be exercise. Right after I turned 40, I stopped working out like classically. I do now, if I'm at the making coffee, I'll do some toe raises. If I get out of bed, brush my teeth, I'll do 2 push-ups. I no longer work out, and I'm in the best shape of my life. It's a cool secret. If you just sneak these things in your daily habits, you never have to go to the gym anymore. Choose to surrender. Most of the time when we want to have control over things, that's when we get upset or angry or discombobulated. Practice gratitude. I love writing in my journal. What am I thankful for today? What's the best thing that happened today? I once dated a eternal pessimist, and I shifted by every day. I was like, what's the best thing that happened today? And then it started, after a while, he would be like, you know what the best thing that happened to me today was? And I was like, I love that, because you shift what they're looking for. And seek sunshine. Okay, thank you. Now, I'll stay a few minutes for questions. Just want to mention, you can get free content on YouTube. If you didn't get the newsletter, sign up for the slides. I'm going to mention that one more time. If you have your phone and you text Healthy Me, it doesn't matter case, it's not case sensitive, Healthy Me, HEALTHY, to 66866, I will send you a copy of the slides, and you'll be on the professional newsletter. And then please come by later today to grab a free copy of my book. I'd love to greet you guys, say hello. Thanks for spending your lunch with me. And like I said, I'm happy to stay here and answer a few questions, but free to go if you like as well. And Debbie over there has the microphone. Thank you. So if anyone raise your hand, Debbie will come over to you and I will answer questions.
The text number isn't working, the 66866.
See Allie right here in front if you want to get, she can, gray jacket right here in front. She'll put you on the list if you want.
Okay, thank you.
Sure. Any other questions? Let's see, we have a mic over there.
Hi, which urine testing do you use?
Yeah, so Real-Time Labs is the one that's been around the longest. They're excellent. Great Plains Labs, which is now Mosaic, and then Vibrant. Okay. And they're all good. The sensitivity and specificity of, that's an order of sensitivity. ELISA technology on Real-Time Labs, down to mass spectroscopy on Great Plains Mosaic, and then the new chip technology with Vibrant. So if you get positives on Vibrant, you're going to get more positives on that test So again, I can't really say there's a favorite there. They're all good. You just have to know what you're looking for. Yeah.
Hi, what about the blood antibody tests for mycotoxins? I think that Great Plains has one.
Yes, there's a new one called EMA, and one is an environmental test for mycotoxins, and one is a blood test for mycotoxins. As we get more information, and again, as I told you, the smoke is the problem, not the factory often, I think these are very powerful. I use the EMA test, which is, so this is really good, a good pearl, listen up closely. If you're in that situation where someone is in their home and they think it's clean and they remediate it and they're like, oh, I'm still sick, an EMA test is a great way to say, is the smoke from the factory still in the house? Because you're testing the environment for mycotoxins, not mold. And same with the human body, you can actually test that as well for antibodies.
But is that more, like, do you prefer the urine test as opposed, does that have more data on it than the?
You have to know what you're looking for. So let's talk about this. Urine is excretion, right? So you just have to know that you're seeing excretion of a toxin, which is good. So you test them and you start treating them, and if you test them in 3 to 6 months, they're gonna be higher because they're excreting toxins, and that's a good thing. But if you don't know that or they don't know that, you're like, what happened? So you just have to understand that. Antibodies are gonna more go along with exposure and can last longer. I don't know exactly half-life as far as is a year out from the exposure still gonna show antibodies? I think if they were really extremely exposed, it would, but I don't know the data on that.
Thank you.
Sure. Question over there?
Are you doing provoked or unprovoked tests?
So all the labs have controversy over this. If you're doing real times, I still use glutathione 500 to 1,000 a day and infrared sauna 30 minutes a day for 3 to 5 days prior. I take them off binders. So that would be the standard. But then like Mosaic Lab says you don't need to do that, I still do it for all of my mycotoxin tests if possible. The caveat is, like when I was really sick with mold, I took binders and glutathione. I got hives head to toe, so sometimes that can be too much.
And how long do you have them in the infrared sauna?
30 minutes, yeah. But again, you have to be careful because I didn't mention this. This is another thing that frames everything and will help you to understand. We're mobilizing and excreting toxins, right? Mobilization is fairly easy. Glutathione, infrared sauna, exercise, sweating. Excretion is harder. That's our lymphatics. And so often people have trouble with excretion. You'll mobilize so quickly that they get overwhelmed, they can't excrete, and they get worse. So if you're doing that, you don't push harder. You pull back on so often sauna, I'll say start 5 minutes, get in at 100 degrees, let it heat up to 105, and then stop. And the next time go 7 minutes. And your goal would be 130 degrees for 30 minutes, but you sometimes have to go 3 minutes in the beginning. Yeah, great question. Over there, anybody? Oh, there we go.
Quick question. How long do you use the binders?
Yeah, so, okay, I'm 6 years out from mold and I still use binders. So, but that's like here at this hotel. I take it with me. I hand it out to friends like candy. You want some charcoal? Because we all continue to get exposed. Now, there's always a question of will it deplete minerals? I have used it off and on for 6 years, and I take a lot of minerals, so I'm depleting them. But when you take it in between meals, I have not seen that to be a long-term detriment. And what I do is get them for, it's basically, my timeline for mold-related illness, I would say 12 to 18 months is a pretty good timeline for getting through the detox. And then after that, we want to create resilience. So we want to give them tools so that they go to a hotel in Orlando and there's mold, they take glutathione, they take charcoal, and they're fine. They can bounce back really quickly. That's where I'm at now. But I still get hit with mold. I just know what to do. But I still take binders whenever I travel, for sure. One up here, question, yeah. Debbie, we've got someone right up here. So she asks, is there a mold air purifier that I like? Okay, so be careful. There's a lot of good marketing out there on certain companies that have these UV lights and devices to clean the air, remediate the air. That's all well and good if you have no sensitivities and you're not one of the canaries like me, because that interaction with the ozone and the different, not the ozone, the UV light and some of those things that they use to clean the air can actually create reactive oxygen as it interacts with the particulate in the air. So someone like me would get lung sensitivity. I would not feel well with some of these filters. The ones you want a good HEPA filter with a VOC filter. And that VOC filter will filter out the mycotoxins because a VOC filter is 2.5 microns or below. Formaldehyde, smoke from wildfires, mycotoxins, viruses. It filters all that. So like I said, Austin Air, IQ Air, Air Doctor, those are the three that I use myself and I like.
Yeah. When we can't use liposomal glutathione, you mentioned selenium, vitamin C, NAC, ALA. What else?
The two rate-limiting amino acids for glutathione are glycine and glutamine. So you can use those amino acids as well. Back there, yeah. There we go, sorry.
So for glutathione in active cancer, can you speak to that?
So there is, okay, I went through this 20 years ago where they said no vitamin C, no antioxidants of any sort. You've got two camps. Your oncologists are typically going to say no antioxidants, that protects the cells we're trying to kill, right? I understand and I actually agree with the principle. What I would do in someone with cancer is they must defer with, like I say I am not your oncologist. You must get an understanding with your oncologist because I will not say anything against your oncologist. Personally, with my cancer 20 years ago, I took some antioxidants against recommendations. I am not recommending that to you or your patients. You have to decide for yourself because there's a risk.
So I thought the antioxidant issue was just during chemotherapy and stuff like that, but when they have active cancer, but not under any treatment, but they
Yes.
need detox,
Yes.
and they have GST SNPs.
Okay, thank you for clarifying. I was talking about just during chemo,
No.
because that's very controversial, right? And I would never recommend that to anyone because I think it does decrease the activity of the chemotherapeutic agents. Afterwards, by all means, I would recommend antioxidants, including glutathione. I do not feel like that increases with the data, and I myself am a guinea pig that takes glutathione post-cancer.
Okay, there was some
Yeah.
some research out there that's saying that it would also.
Well, I will say
route
this,
to-
okay, this is important. I'm so glad you asked that because it goes back to my original thought on those who have a lot of oxidative stress. So what you could do is check lipid peroxides in an organic acid test. If the lipid peroxides are high, they have oxidative stress. And what's going to happen is they're going to take NADPH and glutathione and recycle it and create an oxidized form. And so that's very bad. That's why the data, if you saw the data on NAD and skin cancer, right? Same thing. You're putting something that has the potential to be oxidized in a body that's high oxidative stress. So what I would do is say, do they have high ROS? And if they do, don't
Yes.
use it, right? But that's a great question because I'm not
Thank you for
getting-
that piece. Yeah.
Sure. There we go.
Can you speak on the relationship between heavy metals and mold toxicity?
Yes. So first thing I want to say is back to this whole thing where you have limbic activation, mast cell activation, mold toxicity, old infections, Lyme, Borrelia, whatever, heavy metals, PCBs, and all of a sudden you have this soup and you're like, where do I start, right? Because mold by nature depletes glutathione and NADPH, that's one of the things it does, you're going to always look more toxic when you're in a moldy environment and sick from biotoxic illness. So I always go to mast cell limbic system mold first before I touch metals, before I touch infections. Because what I've seen over and over again is when you get those systems working, we are created to detox, which means if we have heavy metal exposure at small levels or PCBs or whatever, we're actually meant to get rid of it. And if our systems are all working well, we don't really need, we do need like daily habits, but we don't need to do a huge protocol. So I do those things first and then retest. And I would say there's a bigger connection between mercury, metals, and parasites and yeast than there is directly to mold. But it all goes together because the mold weakens the whole system. Yeah. Back there, maybe? Oh, there we go. Test and treat Marcons. Okay, great question. So I'm part of the ICI group, which we have kind of consensus statement and standards on that. Shoemaker was like, everybody treat Marcons. But what we saw in clinical practice was maybe 30 to 50% of people couldn't clear Marcons. So what do you do, right? After 2 years of treating, do you continue? In alignment with the ICI doctors, we all believe that yes, if you test Marcons and treat it, patients often do better. But we've all seen clinically about 50% of people can't clear Marcons or get it recurring. So you can still use something that's benign like colloidal silver with EDTA or an herbal protocol, but I don't feel like I must clear Marcons to get someone well from mold, which is great news. Yeah. Okay. Okay, if you guys are doing the text, it's probably too late for most people, but there's no space with Healthy Me. That's the, okay, thanks. All right, let's do 1 or 2 more questions. I don't mind staying, but I want to let you guys go if you want, so I'll do a couple more questions then.
Hi, thank you. I'm a fellow canary in a coal mine. So when I do testing for myself, I get really, really afraid of coming off of binders, et cetera, or going in the sauna, because I'll get full mast cell flares. Recommendations for like accurate testing.
Okay, this is a great question, because whether it's you're on probiotics and you know you'll have a Crohn's flare if you go off probiotics for 5 days, or whether you're doing, I always say whether it's hormones for a hormone test, binders for a toxin test, or probiotics or something for a stool test, if it's a case where they really, really need those things and rely on them, do the test with it and we'll just interpret it. So absolutely, I've done it a million times with myself. I'm like, I'm not going off those supplements. I take them and then just interpret and know that, oh, my C's high, well, I was taking C that day, or whatever it is, yeah.
Okay, thank you.
Sure. All right, one more question and then we'll wrap it up. You have it?
Anyone? No questions?
One up here, and then we'll. Ozone therapy. Ozone can be really powerful with Lyme and mold. Back to the ROS, which is a great topic here. If someone has a lot of reactive oxygen, ozone can create more ROS. So all these things can be beneficial as long as the person doesn't have oxidative stress. Thank you all so much. Enjoy the rest of your day. See you guys.